Well, some local hospitals are unfortunately following a trend that we're seeing across the country, more cases of seasonal flu. Children's Hospital has seen more than 250 children with the flu since November, and they expect that number to go up. 6 News anchor Lori Tucker has much more in tonight's Caring for Our Kids.
Kristen, the American Academy of Pediatrics is warning that even healthy children can die from the flu. We don't want to scare you, but that is happening right now. That's one reason it's urging parents to get yourself and your child vaccinated if you haven't done that already. It's not too late. Here with more is Dr. Ryan Redmond, the ER director with Children's Hospital. It's always good to see you.
Well, thank you.
Lots of important reminders for parents right now. First of all, let's talk about the number of cases at Children's. Are you seeing more cases of flu right now?
Sure. We are kind of in the upswing of the season. We've had about 250 confirmed cases and then much more that we kind of suspected and didn't necessarily test for, but it's definitely out there.
Definitely out there. It's happening. How do parents know whether their child has a cold or the flu?
Generally, influenza has a lot more systemic symptoms, so you're going to get a lot more muscle aches, you're going to get a lot more kind of vomiting, diarrhea, laying around, more than just kind of your stuffy nose and sniffles from a cold.
Yeah, and let's talk about some of the complications. I mean, we're hearing of some deaths this year.
Absolutely. Now, of course, that being said, most kids will do fine with the flu. They'll feel yucky for, up to a week and then get better. But the complications that we worry about are problems with hydration or problems with breathing. So usually if you're seeing any of those issues, that is the time to definitely see your physician and see if we need to kind of up our supportive care.
Oh, okay. So really push those liquids at home. Push them, absolutely.
Absolutely.
All right. Is it too late? I know we mentioned it's not too late, but I want to make sure we're giving the right advice when we get the flu vaccine, because I know it takes 2 weeks to kind of get in your system.
Correct. You reach your maximum immunity at 2 weeks, but there is thought that there is protection that gradually increases during that time. And remember, flu season is a long time period during the winter, so we're still in the early parts of this. Plenty of time to get protected.
All right, so go ahead and do that. And before we let you go, are there many common mistakes, doctor, that parents make when they're trying to treat their kids for the flu? Something that we can all take away here?
Yeah, with flu, which is common with all the viral infections, the biggest mistake that parents make is paying too much attention to the number of the temperature, because we know that there's going to be a fever during these things. We always consider that once you know you're dealing with a viral infection, it's much more important to pay attention to things like hydration and breathing pattern and kind of the overall big picture of how kids are doing, and those are the things that should trip your gut instinct to get seen.
Yeah, I know. I've always heard too that, like you said, look at the child. If the child is listless, if they're just not being themselves, that's a red flag too.
Absolutely. Yeah.
All right. Dr. Redmond, thank you so much.
Absolutely.
Let's hope we get through this thing.
Yes.
All right. And if you have a question about your child's health, just send me an email at ltucker@wate.com. And then be sure to tune in every Thursday here on 6 News at 5:30 to see if we use your question here on the air. Kristen?